Hello and welcome to the Consultation Skills Course Part 4. I'm Dr. Alex and I work at the Christian Medical College in Vellore in South India. In Part 1 we saw the benefits of good consultation skills and how they are about providing better care for your patients, not just being a nicer doctor or other health professional. In Part 2 we looked at the Calgary-Cambridge Guide to the Medical Interview, looking at the 5 phases and 2 running themes in every consultation. And in Part 3 we looked at power and control in the consultation and how that can help or hinder good communication. We saw that as health professionals we need to give some of our power to the patient so that their agenda can be fully expressed. This is the big idea and is otherwise known as patient-centeredness. Instead of the health professional being at the centre of the consultation, they help the patient to take the centre spot. So what do we need to do? We are aiming to make the consultation a meeting of experts. Well, what do I mean by this? By virtue of my training, qualifications and experience, I am an expert on the disease. I learned anatomy, physiology, pharmacology, pathology. I also learnt biochemistry, but I have no idea why. In my clinical training I learnt medicine, surgery, O&G, psychiatry, peds and the rest. I am an expert on the disease, what is going on in the cells, the organs, the systems and the rest of the body. Health professional, disease expert. But the patient is also an expert. They are the expert on what we call the illness. The illness is the effect that the disease has on them, how it makes them feel, what effect it has on their physical activity, pain or itchiness, stigma or embarrassment, anxiety or resignation. This is the illness, and it is just as important as the disease, if not more so. In this way we can say that the patient is also an expert, the illness expert. In the consultation, we are aiming for a shared expert conclusion. The two experts, health professional and patient, need to come to a decision together about what is going on and what needs to be done next, if anything at all. The health professional needs to incorporate the patient's perspective on the problem into their own understanding, and in doing so offer the patient different options as to a plan of action. If the patient and the health professional do not have a shared understanding, then it will be difficult to progress to the next step. It is less likely the patient will be concordant with the plan, and both health professional and patient end up dissatisfied and frustrated. So how can we do this? Well, in this course we're going to learn about 3 essential skills we can use to share our power with the patient, to let their agenda come out so we can reach the shared expert conclusion. This patient-centered clinical method will help us to give better care to our patients, as we will reach a more accurate diagnosis and the patient will usually be more concordant with any course of action on which we agree. There are 3 essential skills we're going to learn, and they are the subject of the next 3 presentations.